Public sector, as we all know, watching the news and reading the papers, is undergoing significant transformation, both in terms of budgets that are being cut in real terms, but also in terms of the demands of patients and citizens and people who are providing those services as they look to ways of adopting new technology innovatively and to deliver services at a lower cost and more efficiently. We're dealing and talking to many different public sector organisations, be they hospitals, local authorities, police services, and higher education establishments, universities and the like, all of whom have grasped the cloud as a concept and are now taking advantage of the reality of what cloud services can provide to deliver a more elastic, dynamic service at lower cost on a pay-as-you-go, pay-as-you-grow, consume-as-you-grow basis. And these services are being consumed both as software as a service right the way through to infrastructure as a service. Many of the organisations that we're working with are now taking some of the concepts that are outlined as part of the government's G-Cloud agenda and looking to create their own public sector clouds for their local economies and local communities and organisations around them. We're working with local authorities up in the north, we're working with hospital providers down in the south and southwest and across to the east, all of whom are taking leadership within their own communities and environments to create cloud-based services to then provide them out to other public sector organisations, some of whom may be healthcare related, but some of whom may be providing community services or education services. And it's the power of the cloud and the realisable delivery of the cloud that is enabling all of these new things to occur. The primary driver for all of this activity is to deliver better or more effective services at a lower cost within the current regime of budget reductions, both in terms of operating expenditure and in terms of capital expenditure. One of our major customers has embraced the cloud fully as a result of having to work within very restraining cost budgets, but believes the cloud enables him to deliver a better, more agile service right out from his hospital into the community at a lower cost. He believes that cloud is doing something radical that transforms the way that his hospital and community services are delivered. One of the things we're finding is, talking to CIOs, financial directors, chief executives of many public sector organisations we're working with, is that there is a real demand from digital natives, people who are used to consuming services on either tablets or mobile devices, who are used to having information on the go, who are now expecting services to be delivered more effectively out in the community utilising these mobile devices. One of the issues that IT functions have experienced up until now is that their infrastructure wasn't able to deliver effectively and at a low cost the type of services required into these mobile devices. What we're finding now is that the focus on cloud services is having a double benefit of being able to enable organisations to deliver these services out to mobile devices and therefore enrich the lives of patients and citizens in the community.